Hi, this is Colleen Parsons with Health Assessment, and this is a lecture on abdominal assessment. It's very, very important that you review your anatomy. So get into the chapter and see where all of the organs are. As you can see here, your health assessment skills check for the abdomen includes the bowel sounds, includes the kidneys, do you know where they are? Includes the liver, do you know where it is? Spleen, aorta, more lymph nodes, not just in the head and neck. And we will not be doing the liver scratch test or shifting dullness. We won't do those two. We would only do those in specialized areas, but we will be doing the rest of these. So take out your shifting dullness and the liver scratch test. Just put a line through them. There's quite a bit in the online program. I'm going to skip through a lot of this because I am assuming that you are smart enough to go and find your own anatomy. This is a good picture. It gives you a basic idea, but review your anatomy. You want to know which organs are in the right upper quadrant, which organs are in the left upper quadrant, what is in the right lower quadrant, and what is in the left lower quadrant. You want to know these so that when your patient is complaining about specific pain or discomfort in an area, that you can visualize what's going on there and what might be wrong. Your midline organs are aorta, and I will show you all how to find the aorta, so remind me if I don't remember. Uterus, if enlarged, you will be able to find that, but I don't think you're going to be able to, we're not even going to be really looking for it. And the bladder, if it's distended. And in your patients, it is important to be able to palpate a distended bladder and what that means. Hopefully, well, as very often happens, occasionally students get to palpate a distended bladder because somebody has to go to the bathroom. So here again are your quadrants, and here is your epigastric area. Right at the line is right above, below, or at the bottom rib. Your umbilical area is this whole area in here, and that's where you're really going to be listening for those bowel sounds. And your hypogastric or suprapubic areas down here. If you work with infants, especially newborns, the umbilical cord shows prominently on the abdomen. It's actually still attached for about 10 days to 2 weeks. It dries up over that period of time. Let's see. Pregnant women have all kinds of interesting developments with their abdominal area during pregnancy because the pregnancy has to push the organs up and out of the way. I'm not going to go into a lot of detail with this, but constipation is a major problem with pregnant women. If you can imagine, as the developing fetus and the uterus expand, that's going to keep putting a lot of pressure on the large and small intestine. Everything changes. Older, aging people have a lot of problems with their GI tract. It slows down. Your salivation decreases, leading to a dry mouth and decreased sense of taste. Esophageal emptying into the gastric and gastric acid secretion are delayed. A lot of people will say that they have trouble swallowing if they've had a lifelong history of heartburn. That can cause some scarring on the valves there, and they might need a process where they actually expand that area. Found in the older adult, let's see, decreased physical activity, inadequate intake of water, low fiber diet, hypothyroidism. These are all things that contribute to constipation in older people. And older people actually do, medication is a big cause of constipation, and people do die of constipation. And another thing that I want to tell you here is that I actually know a couple patients who died of constipation or bowel obstruction because nobody was keeping track of how often they were having a bowel movement, or the person wasn't telling. They would just answer yes because of dementia or whatever. Often we would get patients into the psychiatric units who were acting belligerent, angry, swatting at people, a marked change in behavior. They thought that they needed to be evaluated by a psychiatric facility. They would be admitted, and then we would find out they were just constipated or had a urinary tract infection. Once we cleared those things up, the patients could easily return. And that's kind of an expensive thing to have happen. So keeping people well hydrated is important. Culture and genetics also take their toll on our GI system. There's a significant part of the world, and if I remember to tell you in class, I will, so somebody remind me. There's a significant part of the world that just doesn't have the enzymes to break down milk, and it's really along the equator. The colder areas, in the further up you go where they're making cheese, and that's how they lived year-round with the proteins, because it was too cold to actually go hunting. Cheese stored well, and that's a main part of the diet. Obesity is a major problem as well. And there's the end of part 1.